So what we'll go through with you this morning is what we're looking at for the renewal for the Highmark. There's no changes in the HSA program. The deductible remains the same. One thing that does change within that program though is the amount that you contribute goes up this year. It's $3,500 for an individual or $7,000 for a family. For this year, the HSA funding, and we have packets of information and flyers here. We're going to go through some of them, but certainly there's a lot of paper here for you to look at and different value-added services that Highmark is offering for this year. But for 2019, the county will contribute to the employees' HSA the last pay of June and December. The county will match on a semi-annual basis contributions that the employee has made for the previous 6 months. The maximum contribution match the county will make for an individual is $550, and any other coverage level is $1,100. So no matter what, coming towards the end of next year, make sure you at least have $550 in that account or $1,100 so the county matches the program for you. We're looking at a little over a 5% increase in the cost of the health care. The contributions for everybody's here. It just went up slightly for everybody so that those are there as well. Wade's going to go through the benefit program very quickly with the HSA, but probably the most important thing that I want to hit on with everybody is that you're going to be getting new debit cards. It's through PNC Bank, and you should have received notices at your home. Real important, and I know Wade's going to hit on this again, but you're going to be receiving your debit cards in the mail in a discreet envelope. So please make sure that you don't think it's junk mail, it's your new debit card. And I'm guilty of it because I will tell you that I go to the post office every day to get the office mail and our personal mail, and I kind of stand at their garbage can to pitch everything. And I actually pitched it and saw it because I ripped it, and then I was like, okay, there's a card in there, and it was my debit card. So just be aware, I'm guilty of it as well. And I do these meetings all the time, so please make sure you don't throw it away. The other piece that you'll know is those debit cards will come in if your spouse is covered underneath the plan. You'll get one for them as well, and you can always request additional ones too. Your money will be transferred over to PNC. There is a blackout period that Wade will talk about as well, but that's kind of it in a nutshell that I have. I'm sure I'll be interjecting, but again, we have a lot of information here for you to look at as well for the value-added services. So with that, I'll turn it over to Wade.
Thanks, Steve. Well, good morning, ladies and gentlemen. Thanks for having me back again, Wade Meyer from Highmark. And just to couple on to what Steve is saying, there's a lot of good information I'm going to talk about here, mainly review. As Steve said, nothing's changing for you, but if you take nothing away from what I'm saying today, watch your mail between now and the end of the year, because there's communications coming out about the switch over to the new bank that Highmark is partnering with PNC. In addition to those debit cards that Steve mentioned, there's some other literature that you need to be aware of, and I'll talk about that before I conclude my part of the presentation. But just to give you a little bit of a recap of your plan, as Steve said, there's nothing changing with the plan design. You have a qualified high deductible plan. Remember, all non-preventive services go towards the deductible. Once the deductible is met, then the plan kicks in, and if you're in the enhanced level of providers, the plan pays at 100% for the rest of the calendar year. That includes prescription costs as well. That all goes towards that deductible. The exception to the deductible rule is the preventive schedule. Items that fall under the Highmark preventive schedule, and we have the 2019 schedule here on the table, are covered at the 100% level. You can find that online as well. If you want to take one with you, please help yourself whenever we conclude the presentation. Now, as Steve mentioned, and as you know from last year, the plan comes with a health savings account, the HSA. And we'll talk about the new vendor and the information coming out to you that you want to be aware of between now and the end of the year. Just, again, a quick recap. A health savings account is a way for you to set aside monies pre-taxed to cover your medical expenses. The county's contributing money into it again this year, as Steve said, in that match up to a particular dollar amount that will be paid out at the end of June or the end of December for the upcoming year, and that flyer's up here that gives you more kind of the way that that math will work out for you. So pick that up as well. In addition, as we said, a lot of stuff here on the table that's going to go into more in depth of what I'm talking about, as well as some things I just don't have necessarily the time to highlight here today. Remember, under your plan, you also have a relatively new benefit known as telemedicine. Telemedicine is your ability to have a consult with a board-certified licensed physician through a video chat device that we're all probably carrying in our pockets or our purse. If you have a tablet, a smartphone, a computer, you can have a video conference with a board-certified licensed physician. They're available 24 hours a day, 7 days a week. two practices that we use, Amwell and Doctors on Demand, and we have a flyer up here that talks about their practices. They're able to call in scripts for you, diagnose many non-emergency situations right there over that consult for you. And although it's just like anything else, a medical visit goes towards your deductible, their going rate's somewhere around the $50 mark, 49, 51, 52, somewhere around that point. That goes towards your deductible. It's a good alternative or a good complement to your family doctor, I should say. They're not going to replace your family doctor. It's still important to have a family doctor. But for those known issues, those things that we know are having a problem, we know what the issue is, we need a doctor to confirm our suspicions, to call a script in on our behalf. It's a good resource because they boast an average wait time of about 5 minutes from the time you're online requesting to speak with a physician until you have that consult. So it's a good complement there. Make sure you take advantage of that access that you have under the plan. Don't forget about the Highmark website. The Highmark website will remain highmarkbcbs.com, even though we're switching over to PNC. That your login, your passwords will still work. You'll just link right over into the PNC platform. But also on the website you have access to value-added services, such as our member discount program through the Blue Cross Blue Shield Association. There are a variety of online retailers that deal with everything from gym wear, athletic wear, supplements, even some hotel chains once in a while will have discounts out there for you just because you're a Blue Cross Blue Shield member. We also have other tools on the website, such as looking up doctors and hospitals to find the right care, the right place of service at the right time. A care cost estimator tool that enables you to look up nearly 16,000 different conditions and procedures, and it will run in real time against your deductible, letting you know what your cost is. Even give you a couple different providers in the region that can perform that service and let you know how they rank on a national standard, how many services they perform, any accreditations they have, any accolades they've had, so you can, again, get the right care at the right time. Also, a wealth of wellness information available on our Highmark website, like the preventive schedule, as well as other tools and health coaches that you can sign up for and take online courses and classes and resources to help you achieve a particular health goal or to manage a chronic condition or quit tobacco if you so choose. Just a variety of items available for you through that Highmark website. We also have a new tool out there called the Doctor Match. It's an online tool. Its website microsite address is drmatchquiz.com. If you're in a situation where you need to find a new doctor, maybe your doctor has moved out of town, maybe he or she's retired, maybe you're new to town, maybe you just don't like the person you're using, or maybe your physician is no longer in network, you can use the online tool and the Doctor Match tool that will ask you specific questions about how you prefer to receive your care. What type of a patient are you? What type of a person do you prefer? What kind of interaction do you like? And it'll pull up a list of in-network providers that match your particular personality with that doctor's particular personality. Now, along the lines of the network isn't changing for most county employees. I say that because all the local hospitals remain in network with Blue Cross Blue Shield. The doctors that practice out of those hospitals remain in network with Blue Cross Blue Shield. And there were a few county employees, maybe half a dozen or so in the entire county, that were accessing some out-of-network UPMC providers in the Pittsburgh area. If you recall, believe it or not, it's been almost 5 years now when the contract between Highmark and UPMC ended, way back in 2014. And that health system was out of network for Blue Cross Blue Shield. But there was a transition plan that was created. It was a 5-year transition plan that gave exceptions to certain Highmark members based on their location or their situation or their history with a doctor or even their age. And some county employees were still accessing out-of-network UPMC providers at an in-network level because of that transition plan. Well, that transition plan is a 5-year plan, started in the summer of 2014 and concludes in the summer of 2019. So we're coming to the conclusion of that. But again, if you're not seeing an out-of-network UPMC doctor, it doesn't matter. That health system's been out of network for 5 years. And you haven't even realized it or even known it or even needed it. You have other resources available like the local hospitals, Allegheny General, West Penn, outside the area like Cleveland Clinic and Hershey and Johns Hopkins, just to name a few. If you are a person that is utilizing an out-of-network UPMC provider and you need help finding an in-network provider, setting up an appointment, having records transferred over, or the MyCare Navigator team can help you do that, or I can have somebody reach out to you, see me at the conclusion of the presentation. But again, we're talking, I think, only about half a dozen or so folks that were in that situation. Everybody else in the county won't see any difference in their network because the network hasn't changed from that perspective. And then finally, the information to be aware of, to make note of the switchover with the Highmark spending account. Highmark is switching its vendor over to PNC. You probably received a letter in the mail maybe 2-3 weeks ago informing you of that, and I can't repeat it enough or reiterate it enough that between now and the end of the year you want to watch your mailing. There's very little, if anything, that you'll need to do. However, there may be situations that require additional steps on your part. Anytime a bank opens up an account for a person, whether that account was opened by you physically and you personally, or in this case Highmark switching its health savings account vendor, ever since 2001, the terrorist attacks in September, banks are required to run the applicant's information against the federal database. And there's a bunch of different databases out there that they run against. And everything has to match up. The point is to make sure that that new bank account being opened up is not being used for illicit services, laundering money, or supporting terrorists across the globe. And if it's a situation where something doesn't match up, the data that PNC got from Highmark or from the county doesn't match up with one of those federal database systems, the banks aren't legally able to open the account up for you. They just can't do it. But PNC does follow up when that happens and asks you for supporting documentation that they may need. It might be something as simple as uploading or mailing in a copy of your latest utility bill showing where you live, or perhaps a photocopy of your driver's license. Whatever they may need, it'll indicate for you. Where we see some issues come up at times is if a person has a P.O. box address only and no physical 911 address. A lot of times the federal databases don't like those P.O. boxes. They're just too easy to be manipulated by folks that are up to no good. So in that instance, the bank may need to require some information from you. That's why I said pay attention between now and the end of the year for any mailings that come out. Don't assume it's nothing. Don't assume it's junk mail. If it looks like it's something from Highmark, looks like it might be something from PNC, don't assume that it doesn't apply to you. Give us a call. Double check it. Make sure you're responding back. There are ways to fix it after the fact, but there can be several hoops that need to be jumped through, several forms that need to fill out, and you might even have some transfer fees that take place after the fact, so just be vigilant of that. There is a new mobile app that PNC brings to the table. That's one of the reasons why we switched over to them. The mobile app is more in tune with the way we live our daily lives. Not to say you have to have a smartphone or download an app to participate and to take advantage of the health savings account, but just another way to access your funds and interact with those. Along that line, Steve mentioned about a short blackout period where your funds will not be available to you. That's going to be at the end of the year. It starts on Christmas Eve, December 24th, and by January 4th you should have full access to your monies. Your monies will transfer over if you have anything left over, and you'll be able to get into that account. With that being said, we picked the end of the year because most people have hit their deductible, and anything that's going towards your plan at this point is paying out at 100% level, so most people don't need to get into their health savings account at this point. And also remember that when you go to a doctor's office or a hospital or another provider, they typically send the bill in 2 or 3 weeks after the visit. It's not typically immediate. So that was another reason why we wanted to pick the end of the year for that short transition period over. When it comes to your prescriptions, of course, it's always advisable to get your prescriptions now or as close to the end of the year as you can, so you have a supply that carries you over that blackout period. Remember, your plan is in effect. Your medical plan will still be there. Your deductible resets January 1. It's just the funds that are in your health savings account can't get into until the 4th of January when that whole transition takes over. If you have to pay for services on January 1st, 2nd, or 3rd, you can always use cash or a credit card or a check, and then after that blackout period opens up, you can request your money back out of that account to pay yourself back. Kind of like we had to do last year when we were setting up the whole health savings account process at the beginning of last year. Watch for your debit cards to come out. They will be mailed somewhere around the 12th, so you should be getting them the week of the 13th, 14th, maybe 17th. Watch for them. You'll need to activate them, follow the instructions, and come along with them. You also get monthly statement services, paper statements about your account from PNC. They come out each month. PNC does charge a $1.25 monthly statement fee. You don't need the paper statements. You can get them electronically through that same Highmark website, and you can sign up to go electronic and eliminate those paper statements, as well as then not get that $1.25 fee. As I said before, same Highmark website, same login that you have. If your internet access, get onto the website after the first of the year and get rid of those statement fees. You don't need them. And when your welcome kit arrives in a few weeks, you'll have instructions in there as far as how to eliminate that particular part of the plan. There are some items that PNC cannot transfer over from your old bank, such as your beneficiary, or your preferences, such as your payment preferences, or if you had direct deposit set up. PNC can't assume that the person you named last year to be your beneficiary is the person that you want to have next year. You have to re-establish that if you've done that in the past, as well as your other preferences, such as your provider payment levels, or if you had any direct deposit information set up. So if everything runs without any problems with that database check between the federal government and the bank, you don't have to do anything in order for your account to open and for your funds to be available for you after January 4. Watch for your debit card so you can activate it, start using it after January 4. But in the interim, if you do get a letter from PNC or from Highmark saying that more validation is needed, or we have to double check on who you are or where you live or whatever the case is, follow up on that. That's very important so that we can get the monies transferred over, get the account opened up without any problems because of that database matchup. So again, no change with your medical plan. You still have your HSA available to you. The county's putting some money in for you. A lot of great information here on the table. Stop up afterwards and pick it up. Watch your mail. Again, if you hear nothing from what I said today, watch your mail between now and the end of the year for materials such as that debit card. If there's any federal background database hiccup, that you can apply to that and take care of that as quickly as possible, and then start using your funds as normal come January 4, whenever the blackout period opens up for you. Any general questions you may have before we move on to the next speaker? Yes, ma'am.
Does all this hold true also for senior citizens?
In what aspect?
Is the plan the same?
If you're a county employee and you're here on the county and you have the county plan, it's the same. Now, if you're covered under another plan, or if you're eligible, or if you're on Medicare Part A or B, or have another plan, you're not able to open up a health savings account and contribute into that. That's an IRS guideline. As far as the medical plan is concerned, though, if you're covered by the county and you're a county employee and you enroll in their plan, it's the health savings account that rolled out last year and continuing on for 19. Does that answer that question as far as what you're asking?
Like last year, I was given my card and told to put it into a separate bank account, which I did. So every time I needed money, I had to go and take it out.
So the county gave you you're talking about the gift card that the county gave you instead of the HSA, instead of the health savings account?
Yes. Yes.
Okay. I'll have to defer that over to Carrie as far as the particulars on that, that gift card situation for 2019.
There are no gift cards in lieu of contributions to the HSA by the county in 2018 with that.
I don't understand that. What do you mean?
Because of IRS regulations, there are certain people, there are certain situations that you're not eligible to have an HSA. And for those people who can't contribute, there's no way of the county looking to match what the employee has put into an HSA. So in those situations, there is no gift card. There is no match on the HSA contribution.
And the deductible's still the same.
It is, that didn't change at all. And the piece I wanted to hit on is on the preventative schedule. Everybody should grab one of these. One of the items that's being covered now is the shingles vaccine for people 50 and over. And the one thing with that is you have to have the shot done either at your primary care physician's office or at certain retail pharmacies. They'll do the shots. You can call in to the 800 number and ask them if the particular Rite Aid or CVS or whoever it is does provide the shot, or you can call that pharmacy and ask them as well. The other piece too is we have dental and vision. Those coverages didn't change at all, nor did the rates, and again, the contribution for those is up here as well. The other piece that I want to mention to everybody is with the HSA and with particular providers, remember you can always slow the process down. If you get a large bill from a provider, for example, call Penn Highlands Accounting Department, ask them to put you on a payment plan so that you can pay over time. I use my dad a lot as the example with this, and I probably used it last year as well. My parents used to spend their time between Florida and here in their retirement. And my dad's mail, he's one that likes to pay his bills right away as soon as he gets them. And his mail got mixed up. So he came into my office and he's like, this is a late notice from Penn Highlands. And he was panic stricken about it. I'm like, it's no big deal. Just tell them you'll send them a check today. They haven't sent it to collection. So he called them and he came back into my office kind of chuckling. So he's like 83 years old and he's quite unfiltered now in his life, is what I would say. And so he came in and he said, you know, I'm going to do that every time. And I said, do what? And he said, call him and tell him that I'll send him the check because she told me if I send the check today, I can cut the bill in half. And so I tell everybody, you know, these are your funds. Ask. It's a simple thing. The other example that I give is somebody in our office was on a very expensive prescription, and she went online and actually Googled the name of the manufacturer, and they had a coupon available that she pays $3 for the script. So it really pays to check these things out to see it's your money. You know, make sure that you look to see if there are other ways out there to help reduce the cost. The other thing that I tell people with these HSAs, because it has that high deductible and you're managing your funds in that HSA plan, is, you know, if you had an x-ray done 2 weeks before and they're asking for another x-ray, question it a little bit. You know, why do you need another x-ray, or can't I have this x-ray that I just had done sent over to you to look at, because otherwise I have this deductible. Other point I can't stress enough is, if you've met your deductible, get your scripts filled now. You know, so that if it's paying at 100%, if you can get a 90-day supply of that script to get you, you know, over that hump, please do that as well. The portal's going to be open from December 14th until the 28th. If you're not making any changes, there's really nothing they need to do, is there, if everything remains the same. But if they need to make changes, you'll have to go in, make that change. You do have to check a box for dependent coverage.
Yes.
Maybe if you want to hit on that piece of it.
Oh, wait a minute, what was he saying about PNC doesn't know, don't we have to go in?
Well, this is different. I'm
Okay.
talking about the portal that has to do with enrollment for the medical, the dental, and vision plan itself.
Okay,
The HR portal, if you need to make any changes in adding, deleting anybody, you need to go into the portal and make that change. And then there's a paper form we require as well that you fill out. With PNC, there may be times where they're asking for a verification, as Wade talked about, in which case they probably would have received
yeah, a couple of people I saw them.
a
he
piece
was
of paper in the
questioning.
mail that
Yeah.
wanted that verification. That's separate than this.
That's correct. So in the HR portal, through when you are adding a dependent, make sure that you have added that dependent in the portal, such as their name, their social, do they have the same address as you, if not what that address is. And there's a box in there, you have to check that box that they're your dependent. Now if you've already done this, they're already on your insurance, you don't need to worry about that. It would be for anyone who is just enrolling, or your spouse had carried insurance and now you're gonna carry it in the new year, or, you know, just make sure that that dependent box is checked, even if it's your spouse. A lot of times you don't really think of a spouse as dependent, but for this purpose, it is a dependent. He or she is a dependent. And the other thing I wanted to say also was that, I don't know if you noticed, but we have a videotape going on here. Paul Dinas is expecting to have this uploaded today. I will, once we've kind of tweaked it, make sure it's all working, we'll send out a co-staffed email so everybody has that link. The purpose is to review any of the information that we've talked about today, if you need to review it. And then it'll also be available through the HR portal as well. So you'd be able to, you know, through your smartphone or your home computer, be able to bring that up and review what we talked about today. Yes.
Stacy, okay, I'm sorry. So somebody had a question?
Yeah, Melissa.
Okay, so our current HSA cards will work until December 24th,
Yes.
and then the new cards, which we should activate when we get them, will
Yes.
work on the 4th of January.
Yes.
Correct. You got it.
Those are the dates.
I wanted to say something too, because we were talking about prescriptions, and I had an incident. When you're going for prescriptions, you go to the medicine shop, wherever you go, and they tell you, this one particular prescription is gonna cost $900. I had a fit when I heard that, okay? One of the girls had told me, ask your physicians if they have a BioScript card. Because and the physicians cannot offer it to you unless you ask for it. This one prescription would have cost me $900 to go through the insurance, and they said, so it pays for part of your deductible. By going on the BioScript card, it cost us $18.
But you have to request that. That's the first I've ever heard that, so
Yeah.
thanks for that
BioScript.
information.
A BioScript card, ask your physicians for
But
that.
you have to ask for it. They can't offer it to you.
They cannot offer
Kind
it
of
to
dumb,
you.
isn't it?
Ask them
Sorry.
if they have anything to help with the prescriptions. Now, it won't happen every time, but once your deductible is met, you pay that, but then through the course of the year, you're paying your other deductibles,
Right.
okay? So if I had to order that medication again, they're gonna charge the insurance for it. I'm not gonna pay the $18.80 for it,
Right.
because the deductible's already
Right.
met.
But
for
it's
me,
nice to know.
Yeah, why pay out
Always
$900?
ask is
Yeah.
what I've found when I've done these meetings is you're best to ask the questions either at the physician's office just or at the accounting offices and ask for the payment plan or any reduction if I pay
Or the
all those
pharmacy,
things.
yeah.
Pharmacy's another big one
Yeah.
is they'll offer different programs. So a lot of the major chains offer programs within them, but your local pharmacies will offer those as well. You just have to ask. They don't have the advertising budget that some of these major retail pharmacies do. So thank you for that.
Yeah,
That's
that's
a
where
really
Penn
good point.
Highlands in the medicine
Yeah,
shop.
Leslie.
and-
Yeah, another, when my dad first went on a really expensive medication, I spent a lot of time trying to find something for him. Patient Services Incorporated, now typically it's something unique, like in Dad's case, it was myeloclosis leukemia is what he had. And so they actually picked up the difference, of what he was able to pay. And, it's been a few years since I've used them now, but I know the last time I looked, they keep adding things on, like people that have, I think even like arthritis and stuff. So it's good to check, and you just put an application into them, and they don't take into consideration your income or anything. They ask basic questions. They don't wanna know if you own property and stuff like that. And it's really good because, if it wouldn't have been for them for a period of about 4 years there, I don't know what we would have done, because it was a very expensive drug. It was like about $6,000 a month, so.
The drug costs are continually
Patient
going up.
Services Incorporated.
Patient Services Incorporated.
I always find that if you just get, like in Dad's case, it was cancer, so I think I started with the Cancer Society. But it's like if you call them and they can't help you or tell you, you ask them who you think could. And if you just keep making them calls, eventually, a lot of times, you'll find things out there that they don't know about that will actually help you out in your particular situation, so.
Thank you for that. I know as well, Leslie's going to be talking too about a plan that you can offer within an HSA too, so that's another piece I think that's important for you to hear. Sorry.
That is for the HSA, the contribution that the county is giving, do I have to have a certain amount in by the end of June?
Yeah, in order to do a match, they're not going to do a match unless
Right,
you
okay.
have that amount in.
Okay.
But so at the end of the year, what I can tell you is
Yes.
make sure that you've at least, if your individual contributed $550 so that they match it.
Okay, so in it, for a family, it's
1100.
11, so I have to have 550 in by the end of June, and the other 550.
Or if
No.
you wanted to put more, you
No.
need to have 11.
550 is the
Individual.
annual, so 225 by the end of June. This explains it, this
But
handout.
your she's family.
I know, but we were just talking individual.
Oh, no, we're
Oh,
talking.
sorry, she switched to family.
Oh.
That was real quick.
Right, so a family has to have 550 in by the end of June, and the additional 550.
Yes,
by the
or
end of
as
December.
Carrie said,
Or
for
half
individuals.
that.
225
You
to
got it.
Carrie,
And this paper explains that.
this year was that the county was only gonna match half of, correct? Last year it was the full amount. Is it this year that it's half and then next year there's no match at all? Is that correct?
No, 19 and 20 are the same, and what we were just saying is what you contribute from January 1 through the end of June, that last pay in June, up to, as an individual, $225, the last pay in June, the county will put $225 in your HSA.
Okay, but this past year it was.
It was different.
Yes, it was double,
It was
correct?
different. Mhm.
It was double.
And you didn't have, there wasn't a match, it was just, it was a gift.
Correct.
Yeah, it was different.
Last year, out of pocket for a family was $500 out of pocket. This year for a family was 19, it will be 16 out of pocket.
16.
Carrie, so I can't contribute at all, right?
You're not eligible for an HSA, that's
Okay.
correct.
Unfortunately, it's the IRS regulations. Unless, you can if you decline Medicare Part A and B.
There's ways to get out of Medicare without incurring a penalty, but I would encourage you, if you're looking into that, talk to somebody from
I just say
Medicare.
it. You have to be
There-
real careful
there's-
with that
yeah,
one.
there's
Absolutely.
nuances about it, so talk to a Medicare professional to see what can I do and how do I do this so I don't incur a penalty later in life, if you want to be able to contribute into an HSA. But there are ways to do it, but I'm not versed enough to
You have
instruct
to be
you, other
real
than
careful
find a
that I
Medicare
mention it,
employee.
but I mention it lightly that there are ways, but I don't know that anybody would actually want to do it. You can check with your local social security office and go through the requirements they have for it and if there's any penalties involved. We're gonna turn it over to
I
Ethan.
There's
have
another
one.
question.
Oh, I'm sorry.
We have a new girl in our office. So when she starts, she'll just automatically go to the PNC card.
When does she start?
I mean, she's here now, but she'll just enroll.
January 1.
January 1's when it's effective, yeah, she won't have any transition over, it just will automatically open up in the PNC account right from that point.
She wouldn't be eligible until after the first
Okay.
of January,
Okay.
so, yeah. She won't know any of that.
She didn't want to ask questions. So.
It's all right. Yes.
I have a question. One of the guys at work, of course, can't come because we can't leave the jail. He was wondering, in order to get the match, like, say, February, he wants to just put a lump sum in. How's the county gonna know that he's put that money in because it's not coming through his payroll?
Well, what I would suggest is that in order to get the tax savings, because the money you put into your HSA is not taxed.
Right.
What I would suggest is, like, I'm thinking probably income tax refund, is
Yeah,
that
I think,
kinda, okay.
yeah.
So, and I had this question yesterday, and I said the same thing, it was a phone call actually after our meeting. If it was me and I wanted to do that, then what I probably would do is for that pay, let's just say February 15th, okay? For the pay of February 15th, I would change my HSA deduction on paper, make sure that payroll has it. He wants to put $500 in, have the deduction for his HSA be $500. That'll be $500 that would not be taxed on his income. So when he gets paid, when he gets his IRS refund, then he can pay himself back. You know, it's kind of like a switcheroo, you follow me?
Yeah.
And then for the next pay, change his SHA, the paperwork, back to whatever, $25 or whatever it is. That way he gets the tax savings. The money is showing as a contribution to the county to do the match. To me, I think that's the best way unless.
I would agree, that's a
you guys
great way.
disagree.
So remember, the nice thing about the HSA too is you can change your contribution at any time. Unlike that FSA where once you said you were putting so much in, you were stuck with it for the year. With the HSA, you can make the change. So that's a really
Do
good
you
thing.
know offhand how many pays there are from January through June?
13?
There are 13
There's
pays.
13 in each half of the
Okay.
year.
And Wade and I will be around after the meeting as well to answer any individual questions for you, but we'll turn it over to you now.
Thank you, ladies and gentlemen.
Thank you, guys. My name is Ethan. I'm representing Sullivan EAP Services. I'm just going to talk a little bit about what we do briefly. If anyone has any questions as I go, please let me know. How many of you, if you could just raise your hand, how many of you have heard of the EAP or know a little bit about what we do? A couple people, most people, okay.
Told you, Carrie.
Generally speaking, what we do is we provide counseling to anyone that works for the county. So we provide 3 sessions of counseling for not only you, but each family member you have that lives in your household. and it's not the same as insurance. It is separate. It's paid for by the County Commissioners Association of Pennsylvania. So there's a little difference there. So they don't have to have insurance through you in order to access the benefit. And confidentiality speaking, it is a voluntary program. You know, no one's going to make you or require you to go get counseling, but it is available to you if you want it. We are required to break confidentiality in a couple of cases, though. Those cases would include if you are imminent threat to yourself. If we believe you're going to hurt yourself, we have to tell somebody. We can't just sit there and let that happen. If you're going to hurt somebody else, same deal there. If we smell any sort of child abuse going on, we have to report that. I think we're all mandatory reporters of that at this point. So that's important too. And the last thing is, if we get a subpoena from a judge or a court, we have to give up your information. And now, in the past 30 plus years we've been in business, that has never happened, but we would have to give up your information if that were to happen. Another thing I'd like to mention too is a lot of people think that they have the 3 sessions of counseling and then they can't renew it until a year afterwards. That is not true, actually. If you have your 3 sessions and you wait 2 months, you can actually renew those sessions and go back. So say you're seeing a counselor with your spouse, for instance. You would have 6 sessions because you get 3 and your spouse gets 3. So you would have 6 sessions together, and then say you just want to work on the things you talked about with the counselor. You give it a 2-month break, but if you're still having those issues pop up again, we can bring you back in for another 6 sessions with your spouse. So that's something that I think a lot of people don't know. That's important. So as far as that goes, does anyone have any questions so far about how we do things? Another thing I want to mention is we do have these up here, these brochures. Talks a little bit about our website. And on our website, we have a work-life section on our website that talks a lot about different legal forms and things, and just a lot of different situations in life, articles and things that can help you out. Log in. We don't know who you are when you log in, so no one gets that information. All you do is type in the code CCAP. That stands for County Commissioners Association of Pennsylvania, and that'll get you right into our website. Does anyone have any questions about how that works or what to expect when you call in? Or
The website's great. If you haven't been on it, you really should, take a few minutes. Actually, once you get in there, it's going to be more than a few minutes because there's so much information. There's just a lot of information in there, self-assessments, the templates for, correct me if I'm wrong, but like maybe even living will or a will itself. So much information in there.
Advanced directives.
Yeah, it's very user-friendly and very informative. So I would strongly suggest that everyone takes some time and checks that website out, along with the Highmark website. They're both very, very informative.
And in terms of resources as well, we have the website. If there's something that you can't find online, or if you're not comfortable using the website and you're looking for something, you can always call us, you can email us, and we also have a lot of other resources at our disposal as well. So if there's something that you're looking for, you're always welcome to get in touch with us. Let us know what you need, and we'll do the legwork and the research that needs to be done and let you know what's out there for you. So, and we are open 24 hours a day. We have a toll-free number. And again, if you're more comfortable with email, you can also email us as well.
Totally confidential. Like, say that like 700 times.
Yes.
Totally confidential.
Even the Commissioners Association, they just get numbers. 5 people use the program, that's it.
And we are bound by state and federal laws that prohibit us from being able to share information under HIPAA, so that does keep everything confidential. Like I said, these brochures will be up front here. We do have some erasable highlighters up here. Those are a newer thing we have, so those are up here. And then there's also a card you can put in your wallet if you'd like to do that, if that's easier. So, no one has questions. At this time, I'll hand it over to Leslie and Jim from Aflac.
Thanks. Okay. Hi, everybody. How y'all doing? Good? Yeah.
Yeah.
It's like Wednesday morning, huh? No response here. Okay.
I have Jim with me this year, Jim Carpino. He's a local fella. I was gonna say boy, but I guess he's not a boy. He's a local fella. So this year, as we come throughout the county and stuff, if you don't see my face, you're gonna be seeing Jim's face. So, but anyhow, we're just gonna go through the packet rather quickly here. Like usual, on the left-hand side, I always put in an information thingy-jigger that you can put your name on it. And as we go down through the different programs, if there's something you're interested in, you know, you can just put a check mark by it so that we know that we need to find you while we're in the county. You know, because we only have a short period of time, you know, to finish everybody up. And also down at the bottom, I also put, I think I have a claim and I need help. I was amazed yesterday at how many people in the meeting yesterday actually marked that, you know, because a lot of times you're not sure whether you have a claim or not. So feel free to just mark that and we'll make sure we get to you and help you with it if you do have a claim. And then I also put on there, I would like to review my policies. Again, that's one of them things, a lot of times people think they know what they have, but they forget what they actually have. So a lot of times we do like to do reviews with people. So if that is something you want to do because you're not quite sure what you have, please feel free to check that and we will stop by and see you also, just to review with you what you currently carry with Aflac, okay? We're going to start on the left-hand side. The first one, we always talk about first, is the short-term disability. This is the one that is designed to protect your income. So if something happens, you cannot go to work due to an off-the-job accident or due to a sickness, it is like a partial replacement of your income. It's up to about 66% of your income. The reason why we pay off the job is because if you get hurt on the job, workman's comp is considered your paycheck, okay? This program a lot of people consider to be the most important program out there anymore because so many of us do live from paycheck to paycheck. So it's just a way to make sure that you have income coming in to help pay your bills. If something happens, you cannot go because you go to work because you are sick or whatever the case might be. One thing nice about our disability policies now, I think this is like the second or maybe the third year, I lose track of time. I think you do that as you get older, I'm not sure. But anyhow, we have the 6-month program. We have different lengths of period of times of program, but the 6-month program, they now guarantee issue under those programs. So it doesn't matter what you have going on in your life. You could have just had a heart attack or a stroke, or maybe right now and you're in the process of cancer or something like that. Aflac will actually pick you up under their 6-month short-term disability policy. Now, with that though, I have to explain to you what a pre-existing condition is. Pre-existing condition is anything you've been doctored for, treated for, or consulted with your doctor on in the previous 12 months. So obviously you're in the midst of a claim. So in the first year of the policy, we are not going to cover you on that pre-existing condition. We'll cover anything that happens to you other than the pre-existing in the first year. And then after the first year, we will pick up the pre-existing also. That's been a blessing to a lot of people that have ongoing circumstances in their lives. So it just makes it so that first year they have to get through for their pre-existing. We cover everything but then after the first year, we'll go ahead and pick it up. So this is a good little policy to pick up with that guarantee issue and stuff on it, especially if you have something going on in your life right now, okay? The accident policy, Jim.
Yeah, sure.
I'm going to let him talk more today.
Good morning, everyone. We're going to go over the accident policy. Here's the gray one in your packet. It's the one that Aflac pays more claims on per year than any of them. They realize accidents happen to everybody, big and small, and this covers things big and small too, pays procedurally. So the only thing that they ask is that you seek treatment within 72 hours of that accident. So if you're hurt on Friday, at least make an appointment by Monday, and that kind of starts the process going. Minimum you're going to get is 120 just for going and seeking treatment. So even if they tell you go home and ice it, you're fine, you're still eligible for that. And that kind of gets the ball rolling. And they pay, if you have to get blood, they're going to pay you an amount for getting blood. If you have to get taken by ambulance because of this accident, they'll pay you for that. And it all stacks, none of it cancels each other out. It comes with a wellness benefit each year, so if you guys are fortunate enough to not have an accident all year, they will still give you a $60 wellness benefit on there just for kind of keeping up with your health. And it's kind of a thank you for keeping current on everything. I know you guys have probably heard about the accident policy, but last year they added a couple new things which I think are pretty important. One of them is a home modification benefit. So if you were to, say now you're wheelchair bound because of an accident, that's going to change your life. You're going to have to change some things in your house, maybe put a ramp in or a new shower or something like that in your house. They're going to cut you a check to help you change because your life's going to change. They also have what's called an organized sporting benefit in here now that's new. So if you were to have an accident due to competition or practice of any kind of organized sport, they're going to pay you an additional 25% more than what they were going to pay you previously. So it's just kind of a way to get people out, you know, get involved in things, organized sports and other things like that. But yeah, they pay a lot. It has a little bit of life insurance in here too, accidental death insurance and dismemberment. So if your accident were to become fatal, they'll pay that to whoever you choose as your beneficiary. And yeah, that's the bulk of it. That also pays to help get you, if you have to go to say you have to go to a doctor or a specialist that's more than 50 miles away, they'll help pay some amount to get you there, and help pay to get you a hotel room while you're seeking treatment there, so someone can go with you and stay while you're, say, down in Pittsburgh or up in Erie seeking treatment with a specialist. So that's pretty much that.
Yeah, it's a great little program too, because it does cover you 24 hours a day. So
Yes.
whether you're on or off the job, whether you're at home, whether you're in your car, whatever, it covers you. I think out at the prison, I mean, that's been a great little place, you know, where the accident policy really has, you know, helped different people out, because little incidents occur sometimes that we don't expect to happen. Or you can slip and fall coming up the steps or anything like that. It covers you 24 hours a day. It might fall under your workman's comp, but under AFLAC, they do cover you even on the job with the accident policy, okay? The next one is the cancer program. That's one of those programs I always tell people we don't like to talk about, because none of us want to have it, we don't want to even think about it, so we just don't discuss it. It's one of those type of things. With the cancer policy though, we actually have 4 different levels of our cancer policy now. So basically, if that is something that you're interested in, we basically have a level that will fit into everybody's budget. Cancer is one of those things that I just feel like, after all these years of being with AFLAC and what I've seen, I feel like everybody at some point in time should really look at it seriously to put it into their benefits package. Because I'm sure if I was to ask for a show of hands, we all have somebody close to us or somebody we work with or whatever the case might be that has had cancer. And so we've come in contact with it, we see the effects of it. And a lot of times with cancer, there's a lot of out-of-pocket expenses on it. Now sometimes, you know, the skin cancer and stuff like that, no, there's not a lot of cost that goes along with that. But sometimes you get into other forms of cancer where you have to travel to a special treatment center, or people have lost weight so they have to buy new clothes, or whatever the case might be. We help with those out-of-pocket expenses by the benefits that we pay under our policy. I've had a lot of different people over the years that have cried when they got their check from AFLAC under the cancer policy, because they felt like they had a good major medical and they were okay, only to realize that the expenses that came along outside of their major medical that it did pay for was greater than they ever assumed it would be. And so because of our policy, I've had different people over the years that have told me how it literally saved their home. I had one gentleman, his wife had leukemia, and the first time I took him out a check, and it was back when we could deliver checks, I asked him, I said, what are you going to do with this money? Because it was over $50,000. And he said, I'm going to get my stuff back. And I said, what do you mean? He said, well, my wife and I worked all these years, he says, to save and have something for ourselves. And with her getting leukemia, of course, she ended up near a specialty area. And so they had to get an apartment and everything for her, which major medical doesn't pay for. And he said, so we had to mortgage everything we had in order to pay for all the out-of-pocket things that came along. So he said, it's literally is going to help me just get my stuff back that I worked all my life for. You know, so it's like little things like that that are really important when I have people say those things to me. So, but anyhow, like I said, it's one of those policies that it is an emotional policy. It's one of them things that we don't like to think or talk about, but it's something that I feel like everybody should have at some point in time. So always keep that in the back of your mind. On the right-hand side of the packet, we do have in here the whole life program. We also do term. We do 10, 20, 30-year term. And we also do juvenile life. And juvenile life is anything from, I think it's 4 days up to 17 years. And it does term and whole life in increments of $10, $20, and $30,000. Life is one of those things that I guess I've never really talked a lot about in the county. But this year I kind of wanted to highlight it just a little bit more, because you guys do have $20,000 on you here through the county, which is really awesome. That is a part of your benefits package. Also, when you enrolled at that time, you were able to put your dependents on, which I'm sure some of you did, where you could put $5,000 like on a spouse or on the children or whatever the case might be. And that is a great benefit. The thing is that if you ever retire from here or you ever left here, that goes by the wayside, because that is a benefit as long as you work here. A lot of people don't think about that, because what happens is when you get to be my age and you look at life insurance because you think you want an additional $10,000, your mouth kind of drops open and you gasp. It's like, oh, you know. But anywho, anyhow, I guess all I'm trying to say is the younger you are when you look into putting that little bit of extra on yourself, because a lot of times we need that little extra on us so that if we pass away, at least we're getting buried, okay? But if you leave here and that happens to you, then I don't mean to make light of it or laugh about it, but I mean, I've done it myself. You know, I've waited too long, and now it's expensive for me to pick up that little bit of extra. So the younger you are, the cheaper that is for you. And so it's just something that, you know, if that's something you don't have outside of the county, it's something you should think about, whether you get it from us or whether you get it from somebody else, you know, your own private insurance guy or whatever. It's something I just wanted everybody to kind of start thinking about, that down the road, because the younger you are, the cheaper it is, so, okay? The next one Jim's gonna do are HSA compatible.
Yeah, the next one's called our choice plan. This is kind of Aflac's answer to the high deductible plans that people are having to move towards now. How it works is, it's almost like a gap plan. It's very simple. You set the benefit amount to whatever you choose. It can be $500 up to $2,000, and if you were to get admitted into the hospital, it would pay that amount to you. So a lot of people match that benefit up to their deductible, say $1,000, $1,500, whatever you want to make it. You get admitted to the hospital, they'll pay you that big lump sum up front, you can cover your deductible, and then your health insurance will take care after that. So it's kind of like a gap plan is how the way they look at it. It has a couple small other benefits attached to it. If you were to be confined to the hospital each day, they're going to pay $100 on that. That's for a full year, they'll pay you that $100 on top of the original benefit amount. If you get put in the intensive care, they're going to give you $50 a day for that for up to 31 days. And also it has a waiver of premium like a lot of the policies do, which means if you were disabled for 6 months or more, they would waive your premium until you were back working again. Kind of not to yank the policy out from under you as you're using it. And that's that one. It's very short, sweet. It's kind of their design to, it's HSA compatible, so it's meant to work with HSAs and high deductibles in today's insurance world.
Yeah, and one thing, I see a lot of faces in here that I know that carry Aflac too, and maybe a lot of you aren't aware of. Through Aflac now, we have what's called the one-day pay. I encourage people to go under the Aflac.com website, set yourself up with a username and password. Then once you do that, you can do little changes on your policies. You can view your policy at any time you want under there. I mean, they've really made it convenient for everybody to know what they have now. There's also, like on the left-hand side, there's different buttons, but the one I always point out to people is the one that says direct deposit. If you set yourself up for direct deposit, when a claim occurs and they issue, the claim, it will go into your checking account instead of taking 7 to 10 days to come up through in the mail. Because a lot of times when something happens to us, we need our money like yesterday, and if the mail is just 7 to 10 days, that takes up a lot of extra time. So I encourage people to do the direct deposit. Also, you can go in under there with the one-day pay. I mean, when you do like your wellness benefits under your cancer and your accident policies, under the one-day pay, if you have gone to the doctor that day and had an eye exam and you have an accident policy, you go back to the office, not that you probably do it on office time, but when you get home, sorry, when you get home, it won't be before 3 o'clock. But anyhow, anytime you file a claim before 3 o'clock in the afternoon, it will be in your checking account the next day. And with your wellness benefits and with physician visits under the hospitalization program that some of you have here, you don't even need documentation for that stuff, which is really nice. They're just trusting you that you actually had that done, okay? So, you get your $60 back there, you get your $25 under your hospitalization policies, and whatever you have under your, the cancer policies all vary, whether it's $40 or $75, for your wellness benefits. So it's really, really nice. And also though, if you do have a claim, whether it's cancer, accident, or whatever, if you have your documentation, you go in under the start a claim, and you just go through and you answer the questions. It's almost like filling out a claim form. And then you upload your documentation, and again, if you do it before 3 o'clock in the afternoon, your money will be in your checking account the next day. That is top priority now for claims, is the one-day pays. So if I fax a claim in for you, which I'm still very willing to do, if I fax it in for you, it does not get top priority. The people that get top priority is the people that do it through the internet, okay? Just so you all know. But yes, that does not displace us. We are still there to help you, to answer questions, to even guide you through what you need to upload. Because I do find a lot of times when people file claims, they miss things because they think they know what they have, but they don't know what they have. Or they get discouraged because they uploaded something and they're finding that Aflac is denying it and they don't understand why, because they sent this in. It wasn't the right form usually. Not that it's not the right form, but it's the wrong documentation. I always tell people, remember, we pay by copies of bills and doctor notes. So if you're going to an emergency room, you need a copy of the emergency room report. If you're admitted to the hospital, you need an itemized copy of your hospital bill. If you're going to physical therapy or doctor visits, get documentation of your day B in there. That's what we need in order to take claims. So always remember that. Doctor's notes and copies of bills. We also have, which I don't use, we also have a mobile app
which
Yeah.
I don't know much about, but Jimmy was telling me about it yesterday.
Yeah, there is a mobile app that Aflac came out with now to kind of help streamline the process a little bit more, and it works along the same lines as the online that Leslie was just talking about, but it'll ask you leading questions to get you to the policy that you need to make a claim for. And it makes it's almost dummy proof, like you really can't mess it up. With paper forms, paper forms, if you forget to fill something out or just skip over something because you think it doesn't pertain to you, then your claim will be denied. But this won't let you hit next until you've filled out everything they need you to. They made it very easy to get your money now.
Yeah, and I guess all you have to do is take a picture of your document.
Yes, and it'll upload it directly to your policy. When you send your claim in,
Technology is amazing.
all the form goes with it, yes.
Yeah, so not that we don't want to help you, we will help you if you've got questions or you're not understand why you're not getting paid, but if you are tech savvy or you're not afraid to try to use your phone or even try to delve into that, you'll get paid a lot quicker by doing it that way, okay? Any questions? We did a wonderful job.
I mean, there's one more thing too.
Oh.
With all the Aflac policies, all of them are 100% portable. So if you guys are ever to retire, leave for any reason, you can take them with you. They just transfer them on your bank account. You keep the same rate as what you had here. It doesn't go up. So you guys actually get like a 40% discount buying it through your employer here than what you would if you were to walk off the street to our office and buy it. So, that's another nice thing to kind of keep in mind, especially with like the life insurance and things like that. If you were to buy it and you can keep it forever, it doesn't expire when you leave.
And with our life, we do ask a lot of health questions. They do ask health questions, but they don't usually require like blood work and stuff like that, which a lot of people like that. Because a lot of times when you're applying for life outside of the workplace, a lot of times they're going to be sending a nurse to you or whatever the case might be. Where Aflac, unless it's a really high policy, they generally don't do that. So. Okay, so if any of you filled out that form, if you want to pass it to the end or something, or just give them to us as you're going out the door or whatever, that way we know if there's somebody that needs help, we can help you out, okay? Other than that, we'll see you in your offices probably at some point in time.
Thank you, guys.
Does anyone have any questions for Steve or for Wade or for me?
I just had a question on the vision. Is there something, like you can enroll in the actual vision plan, is there vision integrated right in with the?
Yeah, there is. It's called Clear Choice.
Okay, what does the Clear Choice cover?
And that's actually a discount program, not an insurance.
Right. It covers, basically it follows a fee schedule.
Okay.
We have benefit grids for it. I don't know that we put them out there, but they're clear. I have some in my car carrier.
Yeah, I've got some in my office.
But it has a fee schedule on it that will show you. Do you have one?
Yeah, but I have notes on it.
That's all right. So I can give them an example of it. So the eye exam, you get one every 24 months. There's no co-payment for the eye exam. It does follow. Does it follow the Davis Vision Network for this as well? So for eyeglasses, the retail frame price of $70 or below, it basically you'll get a $40 reimbursement, and it follows a reimbursement schedule here that we have these sheets for you to look at.
So I can use that at the eye doctor instead of.
You can use both. If you have the vision and this, you can use both. I mean, I
If
take it you have.
Yeah. If it's something that I just need for like an annual exam though, is it worth attaching the extra?
I mean,
well, here's the thing. This is what I believe Rita had told me. So each of those, the one that comes free with the health insurance, the discount program, and then the vision insurance that you actually pay for, pays for an exam once every 24 months.
Okay.
So if you are gonna carry Sarah, you wanna come up and talk about it? Like you did it, you know,
I
yeah.
just got specs right before I came back, and that's what we did because every other year we use the other one.
Yes.
So that way the kids can get an exam
Every year.
we can get an exam every year. One year we get contacts, the next year we get glasses, one on each plan.
Yes.
We pay very
it works
little
out
out of
great.
pocket.
Yes.
Yeah.
Yeah, because if you were to buy glasses and contacts on one plan every 2 years,
Yes.
that's gonna be a boatload of dollars.
Yes.
It is.
But
Exactly.
if you do it every other, it really does work. Like,
Yes.
3 out of the 4 of us wear
And
glasses.
those I call them summary plan descriptions or benefit
Mhm.
grids. Those are on the HR portal. It would be insurance vision, I believe, is how it's actually worded.
Well, I'm just an individual, so I didn't know if it would, I mean, I go for my yearly exam, I didn't know if it is worth it for me to pay the
Or
extra.
do you have glasses or contact
No.
lenses?
It's just kind of preventative.
Yeah, so in that case, obviously you have to make the choice that's best for you, is you're gonna be
Yeah.
paying for an additional vision plan that's guaranteed to come out, and if you're not getting glasses, it may not be worth you
Now,
buying
that
up to
doesn't mean
that.
next time I go, they won't say, hey, you need them.
That's
That's
right.
a good point, and
That's right.
remember,
But I
it's the
was
open
never
enrollment.
clear on what that actually was, that clear vision.
To that point though, if you don't enroll now in the open enrollment, it's no role of the county. They can't enroll you just because you suddenly need glasses.
Right.
Now, if there's a life-changing event, then they can make a change within your plan, but if you just decide now and then they tell you you're gonna need glasses in
Yes.
June, you'll have to wait.
Understood.
Yeah, okay,
So if you
great.
pay the extra for the, what is it, clear?
Davis Vision?
Yeah, if you pay the extra, do you have to have a kind of card or something to use that, or?
Well, there is a vision card that you have as
Uh-huh.
a separate card for the vision program and a separate card for the dental plan
But I
as
mean,
well.
like, when you pay the extra,
Yes, I think what you're asking, so I think what you're asking, maybe this will help. With the discount program, that's with your health insurance, there's no additional card, it's your
Okay.
health insurance card. So that discount program is your health insurance card. When you have the vision insurance that you pay for, there is a card.
okay.
Did that explain it, Joanne?
Well, kind of, but like when she was saying she got stuff paid for and got eye exams paid for every year, I paid the extra, but we have been paying every other year, like.
Make sure that you give your medical card when you go in, so that they
Your health
have that,
insurance
your
card.
health insurance card, so that they have that on file as well.
Because that's what I wear contacts and glasses, so every other year I'm buying, and like every other year I'm having to pay for my kids' glasses, so they get glasses every year.
Just kind of her point, when I took my kid to his eye doctor, I give them both cards, they have it on file, but I can only get them every 2 years. They
Yep.
won't do every,
Yeah, I've
Every
given
year.
them my cards
They
too,
won't?
and
they
that's.
won't,
One off the other?
they
Like
won't.
one discount, one,
Ours runs both
Yeah.
plans
They-
and sees which one is eligible for the most stuff, and that's a plan we use that year. And then they mark it, so next year, they'll use the other plan. I only know because I literally just did it
Yeah.
right before Thanksgiving.
So you may want to check with your provider to see why they're not willing to do
Okay.
that,
Well, 'cause I
because it's a
knew-
provider
Don't
issue,
they
not.
have to be
Yeah.
Years ago, I
Davis
went and did it,
Vision
and
They
provider?
do, but
they told me the one with the insurance doesn't cover glasses.
that's not true.
That's
But
not
they-
true.
they told
It's not
actually
true.
cover a
It doesn't.
certain percentage.
I'm so glad you're here. It
I
always
don't know,
makes it
I
nicer.
literally just did it like a month ago, not even.
So where did you go?
Wise Eyes and Du Bois.
Oh, okay. Because like I've given them my cards, and we've still paid, and there's 4 of us, and so we're buying glasses for 4 people every other year.
See, and
I mean, I still paid some, but it wasn't very much.
Oh, mine was a lot.
I mean, I think I maybe paid $60 for the pair I have on.
Yeah, my
And
kids
those
are
are,
like
they're the thin
200,
lenses, because I'm blind.
and mine were 400.
Yeah.
Yeah.
No.
And my husband was like he had to have safety glasses and glasses, so we're paying like over $1,000 every other year for
I'll be
glasses.
honest, I don't even take my cards with me. I haven't taken a card, they look it up, because I can't keep all 4 of our
Maybe
cards
you go to
together.
one-
It's
Well, that's what
usually-
they look ours up too, but that's
Yeah,
what I
they
get
look it up
charged.
and they print out a thing that has the payout and which one is eligible for what today. And then they'll say, well, you know, you're gonna pay a little more if you use this one this year, but next year you'll get them free, or, like, they kind of manipulate to see which covers what. At least they did for us.
so I have a meeting at 11:15. Will you come with me?
I'll send my
No,
husband.
no, she's not allowed.
So is that good for everybody?
Yes. Yeah, as long as you're covered underneath the medical plan, you have this. And very few plans have this out there. The county's the only one out of all the clients I have. Do you have very many that have this in place? So it is a nice value added.
And I wouldn't want to tell anyone that you need to change providers, but you might want to consider a change in the provider to,
That doesn't make sense to me, I have to be honest with you.
no.
What do they care?
We used to go to Sears and Cranberry, he and I go to the eye doctor in Clarion, and they both did the same, like we paid. And like, so when I get them, I have to get glasses and contacts, so I'm paying every year because I need contacts
So
plus glasses.
think about this though, is like, this is part of your medical. You
Uh-huh.
have this coverage, and
Yeah.
if you're paying extra for the other coverage, you have both to use. So that doesn't make
They were
sense to
telling
me.
me that I can only get glasses every 2 years, that's it for my
I
kid.
actually physically called them, and that's exactly what. My suggestion is, go to Wise Eyes.
Because I do contacts one year and glasses the next.
No.
You called who though?
The same provider.
Oh,
Right, I don't know.
The number on the
Last year I
back.
got
Oh.
contacts, they did glasses, I got contacts.
And I've done it a couple times, and they're even confused about the programs, how they
Because
work.
this isn't a program that's
It's weird,
commonly
yeah.
out there. So
Yeah.
I would say check with Wise Eyes. That's on camera. I was kidding.
Well, that's what, like, they have mine so screwed up that they let us come in, told us we had to come in the middle of the summer and get our eyes examined, but we can't get glasses paid for till December. And we just bought glasses last year. And we go to the doctor.
you can question them.
Yeah.
Well, they look it up and like everyone you call gives you a different answer. Like you call in and you get one girl and she'll give you an answer, and you call the next girl and they're in the same office.
And then I think if that was me, then I probably would call the insurance company instead of the office itself, because they're,
Provider relations will call out if they get a call from you and address it. Have you ever run into it?
any other questions? Taylor, we didn't answer them all?
No, I have two questions that aren't like eye related. Okay, so my HSA, the debit card, can I buy like my hearing aid batteries? Is that what that's used for?
So, yes.
Yeah, on the Highmark website, there's a link to the IRS. Well, I think it's a link to a vendor that interprets the IRS rules. That'll give you a list of items that are eligible based on the IRS regulations. And I believe that that's one that is eligible.
Okay, and then I just have one more. What's the difference between in-network enhanced and in-network standard?
Yeah, that's a good question. The plan that you're on takes a look at the entire Blue Cross Blue Shield network. About 750,000 doctors and hospitals throughout the whole country, local as well as throughout the whole country. And all those in-network providers have a contract with Blue Cross Blue Shield. But all of those providers will then be broken down further into either an enhanced provider or a standard provider based on a big criteria that comes into play as far as reimbursements, etc. Here in this region, and most providers, if they're in network, they're in the enhanced level simply because of the way that criteria plays out. There might be a few standard providers here or there. The columns intertwine with one another, so the deductibles intermingle. You pay on one, you're getting credit for the other, and vice versa. But when you go on the website and look up a doctor you want to put in Community Blue Flex, it'll tell you whether they're standard or enhanced. Same with hospitals. All the local hospitals up in this region are all enhanced. Any doctor practicing, or I should say employed by that hospital would be enhanced, as well as many of the private doctor offices that are independent providers would be enhanced as well.
So it'll be on the website whether it's...
That's right. Yep.
So what do you have to do to hit that second number? I'm kind of unclear of that. I met my regular deductible.
Yeah.
I had a visit with a specialist and I got a whopping bill for it.
Yeah, so you're talking about, looking at the chart, you're talking about the 2575?
Yes.
Yeah. So think of one way to think of it, this is just one way to look at it, is that in network you have the potential to have a $2,575 deductible. But if you're sticking to and using enhanced providers that are listed as enhanced, you pay $1,350 of it.
Okay.
If you're going to a standard provider, then that's when it continues on to the $2,575.
Okay.
But only if you're using a standard provider would it continue on to that.
Okay.
And you have to meet the deductible within a year, or could it overlay to the next year?
No, it's a calendar year, so it starts January 1, ends December 31.
Because I'm just starting right now. I had my physical and I have to go through other things this month.
Yeah.
So I haven't met any deductible yet, so.
Yeah, and it starts over again January.
I'm the same as you. I just started with all my appointments late November and now into December. So anything that they want me to do test-wise, I'm holding off until after the first of the year.
Well, like for instance, I see like the mammograms. Are they covered? Do we have to pay any deductible on them?
If it's your
One
preventative or your annual, then no, there's no deductible because it's part of the preventative. But if there's a medical reason why you're having it done, like you feel a lump or something like that, then it's going to be subject to the deductible.
So in other words, I shouldn't get a bill for it?
No, if it's preventative in nature, you know, for females, the deductible doesn't apply.
Well, along with that though, the mammogram itself as preventative is covered, but if they see something that they feel they want to do more
That's right, then it
research
goes to
on,
deductible.
then it is not, then you pay for that.
Another
That's
point
like
that
it's
I'll
different.
make, you bring it up, it's a really good point, is so you're allowed to have a routine physical exam at your primary care physician's office at zero, you know, copay, zero deductible. Be real careful when you go in for that, because I just had this happen once this year and it was the HR director that went into her primary care physician, actually took the preventative sheet and said, look, I'm just here for my routine physical, I know it's a zero copay, it should be covered at 100%. Well, while she was in the doctor's office, he noticed a mark on her hand. And literally, she said it was 15 seconds that he looked at and he said, oh, well, you know, that's nothing to worry about. Well, she ended up getting a bill for $150 for it. And she was like, well, what? She called the office and questioned, why did I get a bill for $150? Because he was paid for the preventative. She saw it come through that he was paid. But it's because he looked at her hand and then it switched into a medical reason.
So you need to keep your physician on point. Don't look at this.
She was so, I have to be
Focus on
honest
what I
with
tell
you, is
you.
she actually switched primary care physicians over because she was so upset
I would have too, probably.
that she talked to him and said, look, that was less than 15 seconds, I can
Yeah.
guarantee you, and you gave me a bill for $150, which I have to pay. And he went back down from it. So she said, that's fine, you just lost me as a patient and I'll find somebody else. So I will tell you, like even when somebody went in there, you got to keep it on, to your point, you got to keep it on point. I don't want to be charged anything for this, so if you're going to ask me a question on that, like I need to reschedule another appointment and then you're prepared for it mentally. It's one thing if you go in and you're prepared, look I have an issue, I know I'm going to end up paying for it. It's another thing when you go in and you think, this is covered at 100%, I don't need to worry about it.
But there are no loopholes for that. I'm going for a preventative and it turns into something more excessive. Like the mammo, if they want to investigate a little bit further, even though that stems from that preventative service, the doctor feels you need that.
Then it's going to turn into a medical diagnosis and they can charge you for it.
Okay.
What about
Anything
the
with
blood work?
blood work, if there's, you have to watch on blood work too, because there's certain that they'll cover and then there's certain that they won't. So you got to be careful with it.
But if it's part of the routine.
If it's covered underneath the routine, it won't be subject to it. But if they order additional, which they usually do,
Yes.
they'll ask for more tests.
Things is covered in that though.
So what you can take the preventative schedule and say, this is all I want for this. I will tell you that. And what I would tell people too is always mark who you talk to and what they said.
Oh, yeah.
You know, so if you
and
take it,
time.
that you have it. Because I know that HR director understood the benefit as well as anybody did, took that in and then had it happen. So she truly was livid that she got a bill for $150 and just said, how can you look me in the eye and charge me $150 when you already got paid for the office visit once and it was less than 15 seconds that we talked about this mark.
I gotta put a tape over my husband's mouth. Oh, this hurts, that hurts.
We'll all be around a little bit afterwards, but thank you everybody for all your good questions and have a great holiday. It was great seeing everybody.
Those preventative schedules are up here. They're also on the Highmark website, so if you ever have any questions or you lose this, you can certainly print one out from there and like Steve said, have it in email when you go to the doctor's office. Come get these papers so I don't have to keep them.
This was my HSA, and they emailed me this.